All right. Well, we're here with Dr. Rebecca Grebner. Thanks for joining me for an interview on debt by natural causes.
Thanks for having me.
Yeah, I'm excited to dig into a few topics here that we've spoken about a lot previously. And I think that it'll be really valuable for the audience to hear your perspective and at this kind of inflection point for acupuncture in Oregon. How about we start with your perspective on how we got here, how acupuncture arrived at this point? That's a big topic, but maybe you can um, break it down a little bit for us.
Yeah, so I might just say for a minute that I am a graduate of NUNM from 2011. I went back to teach there in 2015, and then I also taught at OCOM. I served on the OAA, like our acupuncture board, as well, and I do clinical training for the Acupuncture Relief Project. So just so you know where I'm coming
Hmm.
from.
Hmm.
Um, I think if we're talking about how we got here, first, where are we at? We're in a situation where we're getting loan caps coming in this year, and then sometime around 2027, the federal government is going to start requiring these schools to issue warnings to students, kind of like you'd see on a pack of cigarettes, that this is like not safe for you to be going to this school anymore.
Meaning
And like data you
the earnings.
Yeah, the
Yeah.
debt to earnings. So, like you've shown on your website, or sorry, your Substack, we are in a group where we're one of the worst performing schools for debt to earnings, right? And so
Hmm.
these warnings are very likely to be issued. We can count on that. Once that warning's issued, a student is not likely to want to attend that program. And so we're looking
Right.
at acupuncture schools closing. And in Oregon, we have two schools left. So we have
Mm.
NUNM and we have Pocatech. And those schools are both within the system in which they are ACAHM accredited schools. And students from those schools have to go through the NCCAOM or NCCAHM now exam in order to get your licensure in Oregon, right? One of
Yeah.
them accepts federal financial aid and another one of them doesn't. And so what we're worried about in the situation where we are is that the acupuncture pipeline is essentially closing. Does this matter to people or not? I don't know. If you are an acupuncturist running a clinic that ever wants to be able to hire an acupuncturist, or you're some kind of employer, it would be beneficial to have acupuncturists coming in. And like for myself, I really believe in acupuncture. I've seen it do amazing things over the last 15 or so years that I've practiced. In Nepal, we use acupuncture in primary care, rural health, and it's phenomenal for what it does. And I would like to see that it doesn't disappear. So this is where we are, and how do we get here?
Yeah.
So part of this issue, I think, has to do with how much money was available to the institutions, right? So
Mm.
we've talked about this. Prior to 2006, there were loan caps, and the institutions had to work under those loan caps. But
Mm.
in 2006, loan caps on grad plus loans were removed,
Hmm.
and tuition started to go up as schools added credits. And these schools, they make all of their money off student tuition. It's very rare that
Right.
we see them actually bringing money in from grants or even alumni donations back.
Right.
And I think
Yeah.
one thing that's interesting to point out is on the HEA group data that was published at the end of September 2023 on their
Hmm.
website. If you go through and you look at all the medical schools and you look at these debt to earnings ratios, which NUNM had a 750% debt to earning ratio,
Right.
um,
Yeah.
and OCOM was at 650%, but
Mm.
Stanford Medical School was at 82%.
Hmm.
And it's not because they don't charge a lot of money for their program, right? It's because
Yeah.
graduates are making enough money to justify what they had to borrow in order to get into the program. And that borrowing is also offset by alumni giving, right?
Yeah.
So we have to recognize that it's also that the school knows when it's not receiving money back from its alumni that there's a problem, right? It's not just
Yeah.
the earning studies that we do. So anyway, the school started to balloon credits out, and out, build this up. And I think you mentioned to me earlier too that we can talk about
Yeah.
the first professional doctoral, which was added in acupuncture. So in
Mm.
2002, and OCOM graduated their first class in 2005,
Yeah.
which also allowed schools to be bringing in revenue off that doctoral degree. And then in
Yeah.
February of 2013, we had the entry level doctoral approved, which
Mm.
meant that schools could now increase the number of credits, increase their revenue. And so now we've ended up with students coming out. I had one student at OCOM in the last year they were open graduate with $350,000 of loans on the
Yeah.
day of graduation.
Yeah.
So it's a
Yeah.
problem.
Yeah. And I mean, it seems like just it's crazy and large, but then if you look at like other programs of similar length, grad programs, like that's the range that people are needing because you've got the tuition, which is high, but then you've also got the just the living expenses, which has also now inflated in the past 5 years by a lot, um, which is part of why it's such a dire situation because with the loan caps, like even if the school lowers the tuition to fit under the loan cap, the student still has to pay for cost of living to like survive the program. And the school is now losing that tuition revenue. And most of the schools, if not all of them, are just really dependent on that tuition revenue. They most don't have a large endowment, and most don't have like steady alumni gifts and giving. Um, and so it's yeah, it was just like we're kind of staring down this the acupocalypse,
Yep.
in starting in July. Well, actually starting, with the loan cap starting in what, 7 months, fall 2026. Because of course that's going to affect enrollment. And then if even if the schools can adjust to that, then you've got the 2027 earnings test, um, which will trigger warnings to current and prospective students. And I wonder if you could talk about the if you have an opinion or a perspective on like how the schools themselves kind of view this problem or the development of it over the past decade. Like, is it just total unawareness? Is it like ignorance, or is it kind of strategic ignorance, or is there just no other way to fit under the accreditation requirements?
So, as far as how the schools view it, I was just a faculty member. And so, my experience of that would have just been denial. Um, and that's as simple as I can say it. The other thing is that, when you're looking horizontally across at everything going on, and it's like as a student and a faculty member, it's really easy to look up at the school and go like, this is all their problem, right? And certainly they're too administrative heavy, and certainly they could have been using some of that tuition money to make relationships with employers and do these other things that they weren't doing. So there's lots of blame on the school. um, but when we start to look up and we start to see the accreditor, and you really only do that when you start to try to design a program, right? So OCOM closed, and there was this huge push of people saying, like, let's make a new acupuncture school, right? So
Yeah.
I had this idea. Well, maybe we can, create some kind of program that we could run through a public university. Wouldn't that be great? It's got, all kind of resourcing in there. We can share classes, so not everything's coming out through the acupuncture program and everything else. So you start to design that. And PSU, for example, they have pre-med degrees that can be on naturopathic focus or different focuses. So we could do a pre-med degree with like a TCM or some kind of acupuncture
Mm,
focus, right? However we want to call that. You can even take some of the requirements so that the ACAHM, our accreditor, sets these requirements that we have to fulfill in our curriculum in order to graduate students out so they can sit for board exams so they can get licensure in Oregon, right? So
hmm
you've got the long list of everything that's needed. So you're going through that long list, and it's like you've got to make this master's degree into a 2-year master's degree in order to get that tuition borrowing down
Yeah.
close enough that it can make sense to the 35 to $45,000 that acupuncturists are making when they graduate. And
Yeah.
I've had people argue with that over time, saying, folks that I know that have been out of school for like 20 years and they're making, some of them even 6 figures in their clinic. I'm not
Mm,
talking about you. I'm talking about the new graduates who have to start paying their loan back within
right.
3 or 4 years, right?
Right.
Because when they
Yeah.
don't make enough to pay that loan back, that's when it starts to balloon out of control. And
Yeah.
by the time they become the person who can make a 6 figure income, if that happens for them, the loan is not manageable, right?
Right.
So
Right.
we're really just talking about these new graduates and what they're
Yeah.
making. So if we want to stay within that range, right, and we want to have a program that costs 45 to $50,000, say it even goes up to 70,000, what you have to borrow total, it's definitely got to be a 2-year master's degree or less than that, right?
hmm
So I sat down, we did the math, we figured out how we can make this work. We'd have to take some graduate level credits inside of the bachelor's degree, right? But the problem is that even if you can, and it's very squished to try to get all of those credits inside this program, like this, the student doing the bachelor's degree, they have no wiggle room whatsoever. They've got to know right when they go in that this is exactly what they're going in for, and they've got
hmm
to be on time, targeting until they get all the way up to that master's degree. And then through that master's degree, they've got to be on time, right? But the problem is that ACHM requires 3 years for a
hmm
master's of acupuncture and 4 years for a master's of acupuncture with herbs. So,
Yeah.
regardless of doing the calculations, it doesn't work, right? So,
Yeah.
that is that's absolutely prohibited. There's no school that could possibly, even if they wanted to, fit an affordable program within those requirements, if that makes
Right.
sense.
Yeah. Yeah. It's like it's very it's like where did that come from, right? Where did the 3-year master's degree requirement, come from? Because it just doesn't it doesn't match other master's degrees. It's very costly. And then you add on the herbal component, and it's like, okay, now we're at 4 years, which would be like a PhD or a doctorate in almost pretty much any other field, you know? So,
Well, we know where it came from. It came from being insular and having,
mm,
academics within the academic institutions define what mattered for the practice of acupuncture rather
yeah,
than having clinicians define it, and rather than having employers define it, and rather
yeah,
than working, within the ecosystem to have any kind of accountability as to what graduates actually needed to have. We're sort of just theoretically coming up with what we think might be the perfect acupuncturist, and just continuing to add these things on. And we can because there's unlimited money.
yeah, yeah. So it's like a combination of a sort of self-contained rationale that's not really connected with what employment after the program, which is kind of supposed to be the main reason why you're going to the program, is to be able to use it in the world and society afterwards and make a living. Um, so that combined with the sort of unlimited potential of the grad plus loans. And so you sort of multiply that year after year over like 20 years, and you can kind of start to see of how we arrived at this point, being like,
Yeah.
like the Department of Ed's prediction is that 98% of students are in alternative medicine programs that will fail the earnings test in July 2027. So it's it's very systemic, I think. And I think that 3 and 4 year requirement thing is really important to understanding the systemic dynamics.
Yeah, especially, when OCOM closed, it was very unfortunate, and faculty were told on the same day that students were told.
Mm,
So, and it was really hard to try to hold space for all of that shock and grief that was happening during the day when I was trying to teach. And then students, they were really upset with the school, which they should be.
mm,
Um, there was a number and the board, there was a number of issues going into it, but it is really important to understand that regardless of whether or not the school had tried to change things, they wouldn't have been able to cut the fat that much
mm.
because of the
Yeah.
accreditor. And we need to see that the state is requiring the accreditor
Right.
for the pipeline, right?
Right. Yeah.
And
Yeah.
that doesn't have to happen. We don't
Right.
have to do that.
Right. Yeah. Right. It seems like the, the state kind of, um, what's the word? Like they they outsource the quality control to the accreditor and to the standardized testing agency. Um,
This
and
makes sense though, right? Because
yeah, it's common. Right.
I think sometimes people don't realize too that the people on the medical board and the people on the board of the OAA, they're volunteers, right?
Yeah.
And so it, it they're they're doing this kind of out of the kindness of their hearts, kind of out of their belief in the profession and the medicine and trying to push that forward. And so um, when you can outsource it to a proxy and have them take care of this job for
Yeah.
you, it makes fiscal sense, and it
Right.
takes a lot of the free work off of people, right? And so
Yeah.
when ACHM and NCCAHM now formed and they came to the board and they said we're going to take care of this to keep, because the board's job is to keep the public safe,
Yeah.
right? And it was sold as that this is the job that they're going to be doing, is keeping the public safe. And so the board, of course, that makes absolute sense that they would do that.
Yeah. And you have a national, if every state except California, if every state is using the same accreditor and the same uh, standardized testing agency, then you can go to any school and practice in just about any state. So it's also like portability and convenience.
100%. Yeah.
Um, and so it's like it's functionally a monopoly, but it's not actually a legislated monopoly. We've found out in Oregon that the Oregon Medical Board, which acupuncture is licensed under, actually it looks like they do have the authority to choose the accreditors that they find appropriate and the like exam providers that they find appropriate. So that's a positive thing of what could happen in the future. But they don't exist at this point. Really, there doesn't seem to be an alternative that exists right now. And so that seems to me to be the heavy lift of sort of turning the page and jumping into like a different chapter, let's say. Um, and then there's still the earnings issue. Like that could maybe bring the cost down, but then there's still the earnings issue and the cost still has to match up with the earnings. Yeah.
Yeah, so we have a couple pieces. Oh, well, there's a lot going on there. So one, I'm not a lawyer, you're not a lawyer. We're kind of
Yeah.
looking at everything we can to see a solution. But what it does look like is that so Oregon legislature makes a statute, which
Hmm.
is the law that defines the thing. So we have a statute, I think it's like OR 677, can't remember, but I think that's
I
it.
think so.
And then that says, how acupuncture is going to be governed. And in part of that, it says that the Oregon Medical Board is going to set rules
Yeah.
that regulate acupuncture. And so nowhere in the statute that the legislature set does it say that the ACAHM or the NCAHM, I have to keep my H's in there now. Nowhere
Okay.
does it say that that needs to be the route for the pipeline of acupuncturists to be licensed, right?
Yeah.
The licensure pipeline. So we look then to see where that comes from. And when we go into the Oregon Medical Board, they have written it in their rule, right? Well,
Hmm.
rules are much easier to change than statutes because if we
Yeah.
wanted to change a statute as a community of acupuncturists, we've got to go lobby all of these legislatures and we have to have them write it in the change. But,
Hmm.
and that could take years even, but
Right. Yeah.
changing a rule, we simply need to propose it to the Oregon Medical Board in a unified way.
Mm.
So this sometimes
Can you,
becomes a problem for the
okay.
acupuncture
Can you talk
community.
about that?
Well, we just have a lot of I don't want to go into it too much, but we have many different factions, right, that are vying for many different things. And there's been historically this sort of like classical Chinese medicine school coming out of NUNM, and then we've got this more research-based TCM school coming out of OCOM, and then we have
Mm.
this community acupuncture process coming out of Pocatec. And I don't want to forget that we also have a number of immigrants who practice acupuncture here that have
Mm.
come in from other countries with training. And we have, people that have come in from other states. And so we have a lot of different sort of schools of thinking around how acupuncture should be practiced and how it should be done. And this sort of classical Chinese medicine school at NUNM is the most expensive and the most credit heavy
Mm.
program, I think, in the country,
Hmm.
actually. But
Hmm.
I would need to verify that. And a lot of that has to do with this concept out of that school about this prestige and their doctors and, like all of this stuff versus the community acupuncture movement, which is really about being scrappy and like working in the field. And obviously with working class acupuncture being their clinical model, right?
Hmm.
So it's very different ideas about on the spectrum of
Yeah.
like where we should go with this. And so when we start to talk about like how we want to work together, I remember even being in school in 2000, I want to say 9 or 8, when the schools were pitching the entry level doctoral to the ACHM, and the community acupuncture movement was justifiably working against that, right? But it
Mm.
created all this tension between all these different people. And
Hmm.
that's tension I don't know that has ever been resolved. And
Mm.
so trying to get everybody to come together and go like, what kind of requirements should we need for the licensure pipeline? Like, how does training need to happen?
Yeah.
We a lot of like a lot of us are going to need to compromise
Mm. Yeah.
and to be willing to be a little bit flexible on that. But
Yeah.
I will say this, right? Like obviously there's different ways that we can run training programs. So we've got Pocatec, which is now Orca, and then we've got Middle Way up in
Hmm.
Washington. Both of them don't accept student loans and they run modular programs where
Yeah.
students can work full time while going to school and then they just come for like a extended weekend each month to do their training. It's a really smart way, to do it. A program like that could accept financial aid, but then could make the loan, the debt amount bearable. They could make the debt amount within, that reasonable under $50,000.
Yeah.
It's doable. But the other thing is that we have to kind of look at like who are our employers
Mm.
and what do our employers need?
Right.
Because having the academics and professionals within the system, many of whom honestly are not clinicians,
Mm.
who are teaching and working and running and administrating these schools, define what the curriculum and the content needs to be.
Mm.
It's ballooned out of control so that acupuncturists are taking so much that they don't need in order to
Right.
go out and get a job and practice. And
Yeah.
they're often not trained to be part of the healthcare system because they don't have the medical literacy that they do need to actually
Mm.
be viewed valuable by what could be larger employers in the state for
Yeah.
us, if that makes sense.
Yeah, I think that's a huge missing link in a lot of, well, it can be in higher education, but I think other industries have done a better job of trying to solve that problem and foster partnerships with employers. Um, and it's actually in some of the federal regulations, some descriptions of career services that the career services of the school, part of that um, could be these partnerships with employers that regularly hire graduates. So this isn't like some crazy idea that it's been thought of before of like, hey, this is a valuable part of an institution. And it really, I think it does has to have to be institutional because that's the like students come and go. And um for example, when I was nearing the end of my program at NUNM, I was trying to, um, I was trying to get a couple nonprofits that I thought I would like working at. I was trying to get them to do a residency to sort of sponsor it, but it's a bureaucratic process and there's paperwork and it wasn't the right time for these organizations. But institutionally, the institution could come back year after year and keep asking that question to multiple, organizations. And so I do think it has to be an institutional project over a long period of time that can benefit like multiple cohorts coming through. And then that also creates a sensitivity and a connection, and the employers are able to say, we need people who can do these skills. If your graduates had these skills, then we would really like to hire them for these entry level positions. And then that can kind of be metabolized and either put into the curriculum or at least communicated to students as like, hey, maybe you want to do this micro credential or this other little training because this is an employer that hires graduates from this program. And I do think that's this really essential missing piece is somehow connecting the what you're doing in the program with an employable set of skills that you can demonstrate competency in.
Yeah, I love the way you said that, and also that you pointed out something that is often happening with students is they're looking for a place, a bridge to go out and kind of
Yeah.
land. One of the issues, with some of the acupuncture schools in Oregon is that the school clinics are not functional clinics that are really training students in the competencies that they need to be out there. And
Mm.
so there you were looking for that, you know,
Mm.
and I think a lot of graduates are desiring that kind of space to come into mentorship or
Yeah.
preceptorship or a residency or an internship, which it was really the responsibility of the school. That is not, the creditor
Yeah.
cannot be blamed for that. That was the responsibility of the school to be using that tuition money in wise ways. And instead
Right.
of like spending it on marketing, to go
Yeah.
out and spend it on building these relationships and creating these bridge opportunities for students and these entry level positions for students.
Yeah. Yeah. Um, and I feel like at least talking about like what's going on, like acknowledging that challenge and the institution's role in it and communicating, here's what we're doing because it's so important to basically create that soft landing from the end of the graduation into like the first year of employment, which then translates into earnings and the ability to like keep up with servicing the loan payments.
Yep.
um, and I think also it's the the many all the other all other healthcare professions have so many more PSLF, public service loan forgiveness options, because they're connected to government agencies, because they can accept Medicare, um, because they can bill Medicare, um, and because they're so much larger and they have so many more nonprofits out there and government agencies.
Yep.
And I do think that was a real missed opportunity over the past decade, is to somehow make it like an alternative medicine priority to incubate nonprofits that practitioners would then work at. I think that was a real missed opportunity.
I agree with that. And also, the schools could have worked on building relationships with larger
Yeah,
employers. They could have worked
yeah,
with Legacy, Providence, hospital systems, rural healthcare systems,
yeah,
federally qualified health centers, the VA, any of these places which PSLF is also applicable for. And in cultivating those relationships and placing students in employment after graduation,
mm,
those employers actually work to help because the
yeah,
reimbursement that the acupuncturist is receiving as an employee is what they get as well too, right? So all of these things
yeah,
acupuncturists are concerned with, like their reimbursement rates and their loan forgiveness and everything else, when you are part of that bigger system and the amount that you're bringing in is actually reflected under that employer, they work for
yeah,
you
yeah,
to make sure that these things are happening. And
yeah,
so, it's this really this relationship building action that should have, we can talk all day about the things that
yeah,
should have
yeah.
happened or shouldn't have been, but that relationship building that didn't happen, it would have been a massive game changer.
Yeah. And there are, you know, at a lot of organizations, there are alternative medicine practitioners, acupuncturists, NDs, and like the alumni are actually there. Like the two places I looked into maybe doing a residency or trying to get them to start a residency, there were NDs, working already at the organization. So it wasn't anything new, but I think that's, if even if alumni can't give money, they can still give energy and time. I think if
Great.
that relationship, if it's shown that if the institution shows that this is a priority and like keeps kind of nudging and asking over a long enough period of time.
Yeah, there's quite a few NDs working within the Providence system that those relationships could have been
Mm,
cultivated and expanded. And
yeah.
yeah,
Well, yeah, I mean, that's part of the way forward. But I wonder if you have any other thoughts or themes on, you've kind of already covered it on like but what do you think needs to happen to move things along, to move forward out into the next chapter, to somehow reach like sustainability or some balance point for the acupuncture pipeline in Oregon?
yeah. So the first thing is that needs to happen, like the most immediate thing, is very clear. And it's that the Oregon Association of Acupuncturists needs to basically take all of their resource away from these other things that they've been working on because they're all moot if the
Mm.
pipeline disappears. They
Right.
need to take all resource and they need to concentrate on this rule change through the
Mm.
OMB and through the Acupuncture Advisory Council.
Hmm.
They need to get that rule changed so that we're not taking away ACAHM accredited school pathway. And we're
Hmm.
not taking away the NCC AHM, but we're just diversifying the pathway. So we're saying that the OMB can approve alternative programs for
Hmm.
the licensure pathway, and the OMB can approve alternative examination routes for the licensure pathway.
Yes.
So that allows the potential for maybe even a community college to take on some of the
Right.
acupuncture training, but certainly a
Yeah.
public university, which would be a really big change, financially for people to be going to a public university, which
Mm.
can even reduce the cost because it's spreading out. You're taking anatomy and physiology. It's not this private school, it's spread
Right.
out. And you may be able to even take many of those classes at a community college, which I think PCC is about $6,000 a year, right?
Yeah. Yeah.
So coming in with some of those classes, we really have to look and see like what the core curriculum requirements are going to need to be for the OMB to approve these. We have to define competencies, right?
Mm.
Once the rule is changed, we can change the rule without doing that, but then we've got to get together and do that, right? So all resource needs to go this way. I wrote a white paper about this. I gave it to the OAA. I think they're
Mm.
actually, it sounds very hopeful. It sounds like they do want to work on doing this. There's a few, you know, issues here, which are that there's fiscal impacts
Hmm.
of this change.
Hmm.
It's going to cost money to, like I said, like the reason we're using proxies in the first place is because it's cheaper for the OMB. And so they're not going to problem solve this for us. So hopefully the OAA and our community, we can come, we can unify and start to collaborate instead of seeing our differences as liabilities, see those differences as assets and come in and get this rule change made. And then we can start to look at like what competencies need to happen. And in my opinion, those competencies need to be really well defined by employers in the state.
Mm.
And when we look at who those employers are going to be, um, we've got like Quest Center for Integrative Health. We've got an acupuncturist working with the Confederated Tribes of Grand Ronde that they seem to have quite a demand for acupuncture out there. We've got actually a number of clinics that are employing acupuncturists. We've got working class acupuncture. We've got Intergate acupuncture. We have a number of NDLACs working through Providence. We have a number of acupuncturists working at the VA. Quest is a federally qualified health center, which actually could be modeled and scaled
Mm.
to rural areas quite well. We we need acupuncturists to be able to do that, but in order to work in these centers, we're covered by Medicaid, right?
Mm.
And that alone shows that the state recognizes that we have some value.
Hmm. Hmm.
Can you still hear me?
It got softer.
Oh, okay. So the state recognizes that we have
There you
some value. Um, and but what we need to have is we need to have medical literacy to
go.
be
Hmm.
able to work in those spaces. So someone said to me like, well, it's no fair. The PTs are just sitting in the hospital doing acupuncture when an acupuncturist should be there. Well, a physical therapist is quite medically literate. They've been working on it for a number of years, and they can also provide a number of other therapies above and beyond acupuncture, right? So if you're the hospital administrator, and you're looking to hire somebody, aren't you going to hire the person that does lots of billable codes, right? Within their.
Yeah.
And why would you hire an acupuncturist when you can have that other allied health professional be doing this? And it's something that we really do need to think about, because if we don't start working with these employers to change the way that we've been doing the schooling, we are going to be pushed out. And what we've got to do is we've either got to train acupuncturists to be medically literate, or we have to train medically literate people to do acupuncture. And right now,
Mm,
it's like that second option is probably more viable.
mm,
So unless we get together and we start working with employers and we start figuring out how to cut these program requirements down. There's so much inside of these curriculums that are unnecessary. And then really make sure that we're bringing, acupuncturists up so that they've got medication literacy, laboratory literacy. I'm not saying order labs. I'm saying literacy in reading those labs and understanding what they mean, right? So you've got to be able to code switch quite well when you're working in one of these environments. And I will say that acupuncture, it's so with our work in Nepal, right? We have a clinic in Bajrabrahi, Nepal, where we have a catchment area of 150,000 people. And since we've been in operation since 2008, we've provided over 600,000 treatments, right?
mm,
And where we have our clinic housed, we do run remote clinics out from this space. But where our clinic is housed, we're also next to a World Health Organization. It has these health posts in Nepal where you can go to get like your vaccines and basic medications and checkups and whatnot. So that's right next to us with a birthing center, a DOTS tuberculosis treatment center, and then a laboratory that we helped put in for our screening. So our acupuncturists, and we bring people from all across the globe, plus we've trained Nepalis to do acupuncture, and they come over and they provide acupuncture. 82% of the people that come in to see us are coming in for pain, right?
mm,
And while we're treating their pain, some of them are very scared of acupuncture when we first start. We get the pins in, and then they go into this, zone where they just start to relax and they start to feel better. And for especially acute pain, someone's going to come in like 2, 3 times a week to see us until that,
mm,
done. A course of treatment is often 8 to 12 visits. So
mhm.
these people coming in, and while they're in, we screen them, right? We screen them because we've built this relationship with them that other healthcare providers that have their 8 minute, timestamp cannot build. And also, who wants to like repeatedly go to the doctor who does like vaccines or your pap smear?
Right.
Something we do because we have to do, right? But people will come to the acupuncturist because it feels good. So we're uniquely positioned with that relationship to be able to check their blood pressure, check their pulse oxygenation, check their, random glucose, and just look at that to see this saves health systems so much money to have early
Mm,
screening done and to start having those dietary and lifestyle changes made, or to start, having a provider that has a significant relationship with the patient helping advocate for their compliancy with their medications. And so we bring acupuncturists from Oregon and the US and all over the world to Nepal. And often these programs, unless they're a nurse or they're some other allied professional that went to acupuncture school, they aren't great at doing this screening and having this medical literacy, but it only takes us a couple of weeks to catch
mm,
them up. And so I think it's really important that we understand that it doesn't take a lot of training for an acupuncturist to be able to do this. And what you do is you become a very important part of the healthcare system that we're lower cost, right? We can come in with a lower level of training and we can play a role somewhere between a community health worker and an allied health professional.
yeah.
That makes a lot more sense for a rural hospital or a federally qualified health center or the VA, right? And pain is one of the biggest things that we're dealing with. So we are actually very well positioned to get into these jobs if we came into those jobs with what the employer needs. And it's also important to add that the employer simply needs us to know the basic minimum to be safe when we come into an entry level job, because they can continue training us while we're on payroll.
Yeah. Yeah. That's part of it too, is like eh, so much can be done through continuing education. You can say it's like I guess maybe an apprenticeship type of thing, or it's just like kind of that learning is kind of dripped in over time when you're in the health system. And then if you want to do more niche stuff, like you can maybe pay for those classes on your own, but those will be like modular and probably um, more convenient and won't be like not everything has to be crammed into the academic institution entry level credential.
100%. This
Eh,
is, sorry, I didn't mean to interrupt
Yeah,
you.
yeah,
On
go
this,
ahead.
the schools are selling this idea to the student that you're going to come out as some kind of doctor that can just like
Mm,
walk into a clinic and just treat, the patient in front of you. And the thing is that that doesn't happen. Okay.
yeah.
The reason you go to the school is so you can be safe. And once you get out of the school and you start to practice, the patient is teaching you, the employer is teaching you, you're learning back and forth in this relationship and you're building and building and building over time through your experience and your interaction. And it's quite humbling, the whole
Mm,
process of it, right? And we don't need to be teaching herbs in these basic programs where people can go be paying for that out of pocket. Medicaid doesn't cover herbs. It doesn't
mm,
make sense for
right.
us to be borrowing federal money in order to pay
Mm,
for training on that. Western herbalists don't do it, and we don't need to do it either. And,
yeah,
some of these more esoteric things, like I'm really into sound healing. I do lots of esoteric stuff, but like that should be paid for out of pocket. It shouldn't be coming out of federal
right,
loan money.
right. Yeah, you kind of have to build a coherent like rationale of like, okay, why are we spending this money for this learning? Like basically create like have those boundaries and have the like the training pipeline make sense and kind of be like reasonably stackable like over time
Yeah.
um, in order to, I think, like just have have the jobs make sense in society. Yeah, and they just like the training um, from my perspective just doesn't. It's become out of balance. Like it doesn't make sense. I think both acupuncture and naturopathic medicine
And we
degrees.
Yeah, and we can argue like all day about how acupuncturists need to learn this philosophy or that philosophy or naturopaths too, but like the more debt you go into, like that ultimately gets passed on to the consumer or
Mm,
our patient, right? And I do everything in my power not to overcharge my patients because I want them to be able to come as much as they can. And I take every insurance that I possibly can to try to work with them. That's the bottom line. These are the people we care about. This is our community. And so we've got to like rein it in and be working on a budget that makes sense. And it's
mm,
not about us. It's
mm,
about them. And if we can like get past some of this like pride and whatever else is going on to work
mm,
within the health system, yeah, it's totally broken and messed up and we can complain about it all day, but it's also where most people go when they need
mm.
help.
Yeah,
And like we can make it better,
yeah,
can be part of that.
yeah. Well, let's end on that hopeful note. And I will be kind of observing and I guess writing about how this process, this transition process, hopefully occurs through the Oregon Acupuncture Association and the Oregon Medical Board. So I'm quite I'm optimistic and I'm positive about it. And so I just really look forward to seeing how that I think obviously there'll be some difficulties, but I think it'll be some like healthy negotiation and
Yeah,
compromise. That's what I really hope. So that
so too.
yeah, the acupuncture pipeline can be preserved in Oregon, and the employment outcomes and uh, just end up making more sense for more people and end up um, serving more patients. Um, so thank you for taking the time for the interview. Really appreciate it.
Ryan, I really appreciate all the work that you're doing, and
My pleasure.
I think it's helping in more ways than I can say here. So
Yeah, happy to be a part of it. Okay.